So story numero uno. Starting out with the hospital shooting. Yes, that's where we're going to start today. But don't worry, there is good news coming your way. All right, so stick around. Just hear me out here. But we got to talk about this because it's a scary situation. So there was a man that walked into the Westchester Medical Center in New York and ended up killing a patient and himself. Both himself and the patient that he murdered in cold blood were 70 years old or around that age. And the twisty twist in the story is that they were married. And according to reports and people that were there, the husband that came by to visit the wife, often even before this situation, they had no signs of this. No one guessed that there was any abuse, but they haven't even put out the reason that the wife was there in the hospital. Who knows why? But my question is, he went into the hospital with a gun, and this always gets me to shake and just get a little afraid, just because I know at the hospitals I've been to and the hospital I work at, you just walk through the door, doesn't jacket, coat, whatever. Yes, there's security guard, but unless you're carrying the gun in your hand and it's not in your pocket, no one would stop you, no one would ask you, no one would search for you. And I don't want to get to the place in America where we have to do that, but this is a scary situation. I mean, can you imagine just going through your day-to-day at just doing your job, and then one of the visitors, one of the patient's family, or anyone at all just walks into the hospital, guns blazing, and starts shooting up the place. Because they were in a relationship, the questions obviously out there: was this something that he has planned to do? Is this something that she wanted to happen? You know, when there's a lot of patients, and especially without the euthanasia in this country, there's a lot to it. We don't know what the details are, but this is what happened. And this is not the first time. This happens quite often. There was actually another shooting in Bronx. There was a hospital in Bronx, New York, last year, 2017. Very not a similar case at that time. I actually did a story about this, where a gunman came in after he was fired or let go because of some sexual harassment accusations. He came in guns blazing, killed one of the medical staff, wounded 4 or 5 others, and then ended up killing himself. We can't have this happen. I also don't want to live in the situation where every time I walk into a hospital, instead of me running up to go visit my friend, family, whoever is there, instead of me going up to go to my goddamn job, go to my unit to start working, I have to get patted down to make sure I don't have a gun. I don't want to live in that world, but we need to find a way to stay safe. You guys know my feelings about gun control. I want as much gun control as there possibly can be. I want recheckups. I want background checks. I want to make sure that people are mentally stable who are buying these guns. I want the whole 9. Right? I want it all. But we'll get there, right? We'll get there.